just thank everyone for being here, and Craig and I are very grateful for this opportunity. I think we spent a lot of time together over the last year talking about the industry, and just seems like Healthcare Sharing Ministries, ours in particular, is just a natural fit, for this conference. So I know we're both very grateful to sponsor this and to be here and have these great conversations. And we also want this to be more of kind of like an open session too. And so I know they said they'd give us the option of have questions now or later. We'll take questions anytime if you think of some. And but one of the things that we're really proud of too here at both our ministries is that this part of being part of this movement, where how we purchase healthcare for our members in a unique way, in an affordable way, and also in a conscious way, that doesn't violate our conscience. And that's basically the founding of Health Sharing Ministries. So those that don't know about Health Sharing Ministries, what we do is we have a gathering of like-minded members, usually on a religious affiliation. They sign a statement of faith, and then medical bills are shared upon that statement of faith. So for an example, we won't share in things that are, contrary to Christian beliefs and such. But that's just on the conscience side. But we also do a lot of great work, both of us, on healthcare pricing. Is how do we get the most affordable access to best care, but also at an affordable price? And so that's where we share a lot in common there. And just to lead off a discussion, we started Solidarity HealthShare was founded in 2016 in a response to the Not So Affordable Care Act. That's what I call it. And since then, our members pay about 136 to 138% of Medicare in our pricing. That comes with some complications and some stress, right, on our members with some issues that we see. But our members are there to fight. And the more I believe we can take, transparency is a key, like we talk a lot about here at this conference. But the other key is how do we get our members engaged in the healthcare process, right? And how do they know when to ask for, different discounts? I'll just give you one quick example, me personally, then I'll let Craig speak for a little bit, and we'll open for questions anytime too. I went in for an MRI with nuclear imaging, and I walked in and they said, it's going to be $9,000, Mr. Hahn. And I said, I don't know much about healthcare. That's what I told them. But I'm on Solidarity HealthShare. Did you call them? Oh, no. Well, since we didn't get a chance to call them, you owe us $9,000, give your credit card. I said, listen, your lack of poor processes in your doctor's office for not calling and negotiating with Solidarity, it's not my problem. I'm getting this nuclear imaging MRI done, and I'm not paying you $9,000. So they hemmed and hawed a little bit. And when I was there, somebody came from the background. Is that patient here for that nuclear imaging MRI? Because this stuff expires tomorrow. It's the shelf life. We got to get this done today. I knew I had a pretty good advantage there, right? And then they said, okay, we're going to go for $3,500, Mr. Hahn. Why don't you give us a credit card? And I said, no. And I was just pretty blunt with them. Well, why don't you want to pay $3,500? I said, I want to be pretty brutally honest with you. I don't know if you're trying to screw me or not. And I'm part of a ministry that if I overpay for healthcare, it impacts the body of Christ and all of my other members that are with me, right? And they said, okay, sir, after you get imaging done, we'll call Solidarity, but check in with us when you leave. You think I checked in with them when I left? After I got the imaging done, I was out of there so fast. And you'll never guess, they tried to bill Solidarity $3,200. We got it down to $1,200, right? And so look what would have happened to our ministry if I would have popped down a credit card for $9,000. We would have overpaid by over $6,000, $7,000. And what we've talked a lot about too is the only wiggle room people have right now in the doctors and the hospital space are ministry members and self-pay patients, right? That's who they try to take advantage of. And so we're working on some things in Congress right now, how to protect the self-pay patient, especially for ministries as well. So if you could keep praying for us that we keep moving forward to protect this movement. So
Brad's got an interesting, very interesting ministry. And ours, we started in 1981. And a small town minister in Northern Ohio was involved in a horrific car accident that claimed the life of his wife and one of his daughters, and left the remaining part of the family hospitalized. And he accrued a massive amount of medical bills. He was uninsured, and he prayed and asked God for a miracle. And 6 months later, due to the contributions of fellow believers, he was able to satisfy all of his medical bills. And so the scriptural mandate for Christian Healthcare Ministries is Galatians 6:2, where it commands followers of Christ to bear one another's burdens and so fulfill the law of Christ. And so what we do at Christian Healthcare Ministries is very simple. Our members make monthly contributions based on their chosen level of participation. They then go and identify to the providers of their choice as self-pay patients. They receive the associated self-pay discounts. They then submit the eligible medical bills to us for our adjudication and review, and we reimburse the member. And that's as simple as it gets. And so what you find is an organization that provides great value through faith, flexibility, and freedom for our members. Okay. It's an exclusive organization in that we only are a group of Christians who are aligned by a similar view of God and faith. So we have a statement of faith that all of our members share. But what the solution does very effectively is it harnesses the power of free market economics, and it combines that with the power of a Christian faith community to deliver a robust solution that actually not only competes directly with insurance and big providers and all that, it provides a better outcome at a more economic, at a more robust economic value. And we've been doing this now since 1981. People who don't think that free market solutions work, we have north of $12 billion that say they do, and satisfied medical bills. And in the past 12 months, I'm grateful to have members of my team here. We have our CFO here, and I think, Charity, we were north of 1.6 billion last year for our members. So what I would say is this: we, as these wild revolutionaries getting ready to upend the system, and we're the remnant that's fighting to break the monopoly. We're natural partners together, not only as providers, but as a group of consumers, not claimants, not third-party recipients of third-party buyers, but consumers that have been empowered to navigate the healthcare market as coveted cash payers. That's what we do. And so we're natural partners.
Yeah, exactly. And so to get in some specific questions, if anybody has any questions, just raise your hand. We'll take those. But when we had a meeting with the leadership team here, there were some issues that they wanted us to discuss. And one of them was a direct primary care, and that's been a big uptake here in the last many years. And so when we started our sharing ministry, and we amended our member guidelines to include direct primary care, the monthly contribution that the member has to do. So we reimburse that monthly rate for our members, just so we think that we can get some good access to affordable care. And it's actually saving our membership dollars, by doing the direct primary care. We need to promote that better, I think, because we only have about a dozen out of our 5,000 families right now that are doing it. And so after this conference here, I'm going to make a push when we get back. How do we promote that more? But how it usually happens is somebody from DPC who has a DPC practice will call us. Hey, will you work with our family? Yeah, absolutely, we'll work with them. So we got a mechanism to do it. But as a semi-young ministry to compare to Craig's ministry, we're still growing, and we can't do everything all at once. But it's on our horizon here to really make a DPC push here too. So,
I think one of the things that we do, again, not being a community of claimants, but rather a community of consumers and medical autonomists, we promote individual responsibility among our members. And that is largely vacant when you look at some of the traditional models that are out there. Individual responsibility. When you talk about an individual responsibility, you're talking about preventative care. We promote that. And so how do we do that most effectively? Well, for our members, I think the most effective path is to hook up with a DPC. If you combine the DPC component with the cost-sharing component, our members enjoy true market freedom in healthcare, unconstrained and uninformed by the revenue-optimized vortex that exists in the monopolistic system. And you hear a lot of talk out there today about price transparency and accountability and all that. And we also know that there's been legislation that is passed, and all of these things they're talking about. And has it really affected the market much? No, because where is the tip of the spear? Well, I would suggest this, that if you're part of the system, then price transparency really doesn't mean anything to you, right, as a claimant. But if you're not a part of the system, which we are not a part of the system, we're the tip of the spear that champions and cheerleads these efforts that will challenge the system and will bring free market principles to be able to save the system and achieve a sustainability.
Yeah. Let the lawyer go first, I guess. Yeah. Yeah. And yeah, how our approach is, the burden's on the employer. And right now there's really not a credible solution, for employers over 50 with health sharing ministries. That's because how the laws are written, right? Members of health sharing ministries, you cannot deduct the monthly contribution, like you can under insurance under Section 213D. Employees and employers cannot deduct under Section 106, for the contributions that they make on behalf of their employees to a health sharing ministry. And, and all the ICRAs and all the HRAs and all that stuff is all attached to high deductible plans, right? Yeah. And so that's fundamentally, it's an unfair, almost a discrimination and a bias against our movement here. And so I don't want to get ahead of our skis too much, but Craig and I are putting together some plans right now, and we're working on something together in Congress right now to start chipping away to make it accessible, because, to me, it's always amazing as an attorney when you read it is, Department of Labor under ERISA has a different definition of what a health plan is. Department of Labor has a different definition, Treasury's got a different definition. And so this nonsense has got to stop, and if we were truly accessing the free market association, like we're doing here at the free market, let's level the playing field, and Craig and I talked extensively about this yesterday is our approaches to healthcare with the transparency, and how we engage and how our members and our consumers engage in healthcare. That's what's going to save this healthcare industry right now. I mean, I always look back and when the Pentagon under Ronald Reagan, remember they're paying $1,000 for toilet seats, and $1,500 for hammers. That's what's happening right now, and unfortunately, all these hospitals and most of these doctor providers, what they have is they got contracted rates for Medicare and Medicaid. They can't wiggle that. They negotiate with health insurance companies. And the last thing is that the self-pay patients are being held out to dry. Now, the Trump administration did a really good job with the No Surprises Act. And we were able to, through a congressman in Pennsylvania, get that definition written broadly enough in that statute to include health sharing ministries without mentioning healthcare sharing ministries, by the way, because I didn't want a target on our back. And so right now, there are some solutions that are being sold out there, and we just got to be very careful of that. What we've done in our practice, I'm in a ministry now. I've still got my lawyer hat on for 20 some years, right? What we do is we have a program called the Patron Program. And so a lot of times somebody will call in and say, I want to pay for this nun so we sign them up for a Patron Program where we have another person pay on behalf of this person. And we do that for businesses as well. So businesses that are over 50 that want to offer solidarity, they will offer it to their employees and they will pay, for it. And like what we do at Solidarity for our members or for our employees is we have to increase their pay because it's not tax deductible to us, as a ministry. And so there's some hurdles you got to jump through, but we try to make it accessible to everyone. But we can't actively promote because health sharing ministries is based on individuals, not on group coverage. So,
yeah, I think we're a B2C model. We're not a B2B model, and our relationship is with the individuals. So the many of the organizations that we serve that are 50 and up are ministry organizations where there's a commonality among their staff that they can, sign our statement of faith. And then the relationship of the compliance piece with the Affordable Care Act, the IRS, is handled independently of their relationship with Christian Healthcare Ministries. And to what Brad was saying, I think that it is, if we're going to be able to scale and bring true solutions to a sick system, legislatively, there's going to have to be some adjustments made to open this up. not just to create another monopolistic environment, but to open it up because we see the competition is vital. It's required. And of course, in our case, it's through Christian ministry organizations, but perhaps there are other organizations out there that could compete as well. You think about some of the problems, there's an employment trap for those people as well, where you get locked into something and you can't afford to change jobs or leave that employer because in doing so, you're going to have to climb the pre-existing condition ladder. Perhaps you're going to have to go to something else that has a completely different set of providers, all of that, perhaps even mid-treatment in some sort of condition.
Yeah, the other issue too, what we've seen is this being recorded, by the way? It is? Okay. So I got to be careful what I say. So, you talk about the monopolistic system, and I'm going to pick on insurance agents, health insurance agents here, is the domination that the brokers, insurance brokers have on this monopoly is so real. The minimum participation rule. So like if you're an employer and you got 400, 500 employees and you go to your broker, I want to start offering health sharing ministries. What's the first thing the broker is going to say? There's a minimum participation requirement on your insurance coverage. So if we don't insure at least 90% of your employees, you're out of luck. Right then, that's another hurdle we got to go through, right? And so then the employer's got to do math. Now I got employees on health sharing ministries that I can't write off for a tax deduction. So I got to up their salary, and so then that employee is going to pay more income tax than somebody sitting next to him. And so there's all these hurdles that we have to jump through. So we'll disclose those to the employer, but I go to Italy a lot. It's basta. Time to stop this nonsense. And I'll be the first person to say, and Craig will agree with this too. You think we live in a free market system in healthcare? It's crazy now where insurance companies own doctors. What percentage of doctors are now owned by insurance companies? What is it? Yeah, 70%. Yeah. And so then now they're buying hospitals. So could you imagine negotiating with themselves? Who's going to lose?
Well, there's definitely an employment trap that exists out there, and we're an organization that helps people escape that trap if we can get just a few adjustments. Because think of the portability as well. But generally what happens is if someone goes from big employer to 1099 for a while, and they're going to be a part of one of our organizations for a period of time, and then another big employer is going to come along and they're going to take them on. And it doesn't make sense to stay. They can't stay. Maybe they're required to be a part of this in so many ways, or they sense that. And then they become a part of another organization in that way. It just really is a system that has been revenue optimized and rigged. I can use that word in this room, rigged to benefit someone other than the two primaries, which is the patient and the practitioner. It's been rigged for the middle.
Yeah. And so one last point on DPC and, why, if you look at, I guess I'm probably the only one in here that's probably reads the Health and Human Services regs on conscious protections every time they come out. New president comes in, old one comes out, new one come in, and they basically keep recycling these. But a friend of mine wrote the one under the first Trump administration, and it really hit me too, is we're not focusing on patient outcomes enough. And we've talked, and there's some groups here that are talking about this here that are participating in this conference this week. And to me, conscious protection that we afford in our ministries, healthcare, quality of healthcare improves. Why? Is because especially with like a DPC model, we got a couple of Catholic DPC organizations that we work with, and our member comes in and says, "Oh, we already have a like belief. I trust this person. We're aligned on this on the worldview. I trust you. I'm going to share more with you. I have confidence in this relationship." That's what it's about. It's about building that confidence, that relationship between the patient and the doctor, right? That's how you get better outcomes in this country. I just had an eye procedure done, and I walked in, the doctor looked at my eye, walked out, "We need to do blah, 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 this." And then the nurse came in and said, "Okay, you want to sign these consent forms?" And I said, "No." And she says, "Why not?" "I don't know what the heck this guy's doing to me. I don't know what the problem is. I don't know why this happened in my eye. I don't know what his solution is." And I said, "And I'm not signing anything." And she looked at me, I said, "I'm not being obstinate, but I'm an attorney. I want to know what the heck's going on," right? So the doctor came in and apologized and spent 20 minutes with me. Got out the eye thing and said, "Here, Brett, well, why did that happen to me, doc?" That's because you're getting old, right? And so, but then I had to push that relationship on him, and before it's just like it's a mill. So that's what I like about what we can do too is, and how conscience is so important in healthcare. Trying to find like-minded people that you trust, that you can grow a relationship with, and that's one way you can get healthy outcomes. And unfortunately, that's what with Health and Human Services, that's what when now Trump's back in there again. So all those regs that my friend wrote back there are now going to be the rules for Health and Human Services on conscience. So
Yeah, I think one of the other things you think about the theme of the conference here is, flipping the script on the monopolistic environment. When I look out across this crowd, I see a group of innovators, and the way that what type of environment can innovation thrive in? I can tell you, it's not in a monopolistic environment where things are fixed. Innovative thinking, challenging the status quo is just really not tolerated. Without getting into the politics of it all, you don't have to go back very far to understand what happened during COVID, where critical thinking and challenging whatever the prevailing narrative was simply not tolerated. Well, there wasn't a lot of innovative thinking in that particular period of time that wasn't within the bounds of the agenda. We are innovators, and we're constantly challenging the status quo. We're constantly thinking outside of the box, critically thinking. And we're a group of organizations that think like that. Our members think like that. They are consumers. You just heard a consumer thought process, not a claimant process. A claimant process is, yep, I'll sign up. I'll do whatever the good doctor told me to do because I know he's watching out for me, without any thought to what his motivation might be or what our outcome might be. But an empowered consumer said, no, I need to think this through myself. Innovation can happen in an environment where people are free and flexible and they can maintain their own autonomy. We are organizations that have large communities of people who want to interact with people who are innovative. We want to be a part of the solution, not participate in the problem.
yeah, exactly. And we need your help too on a lot of the innovations that we do. So Craig and I are both very grateful to be here to interact with you. And one last thing too, I want to share what the Biden administration did, and a good thing is when they took the medical debt, off the consumer, credit reporting. That's going to it's going to be interesting to see. I'm still struggling with what the outcome is that's going to be. I think it's a good thing because it's going to take a bargaining power away, from the hospital systems, with balanced bills and stuff like that. But we'll see that industry responds to that. So we'll see what their next steps are. But I think that was a good step to do that because, as you know, what I never understood is anytime a bill would go to a credit reporting agency, that debt has to be a valid debt. And when you make up these things and charging 1,200% above Medicare, and you contest that, how can they take that bill to a credit reporting agency for that full 1,200%? That's against the law, And so I know there's some groups here on the legal side of that I'd like to talk to if you're in the group, because we're trying to push back on some of those issues right now as well.
Speaking of medical debt, I've got two quick stories to tell and we'll get to the question. A couple of years ago, I was on Fox and Friends in the morning, and just before we went on stage, our Defense Secretary, Pete Hegseth, or now, he was on the show that morning, he came down and we were talking briefly. He said, hey, Craig, he said, just tell me, how do you guys help pay off people's medical debt? And you realize that the vast majority of medical debt in the United States is held by people with qualified plans. I don't know if you're aware of that, but it's a massive number, and it's held by people who they are insured. Okay. He said, how do you help them pay? And I realized in that brief second, but in the break, he doesn't know what we do. And we're getting ready to go live in front of the entire nation. And I'm going to be put up as somebody who pays medical debt. And I said, no, Pete. I said, we don't help people pay off medical debt. Our members, we help them avoid medical debt. And so I think that's one of the big things when you think about the problem in America today. There's a Galatians 6:2 that says, bear you one another's burdens. Galatians 6:5 says, and every man shall bear his own load. And so I would say this, what our members cannot rightfully expect to budget for in the course of a year when it comes to their health care, That is what Christian Healthcare Ministries is there to help them with. And we want to do so in such a way that they're not left with a crushing burden of debt. Try that in almost any other solution that's on the market.
And you had a question back there? Or are we done? What? Out of, okay, questions? Go ahead, sir. Yeah. And so the question is how do we, as ministries, how do we guide more care to those, that are favorable to our mission? And we have a care navigation team. And if you want to get promoted by Solidarity, we can't really promote docs, but we can make recommendations on service and stuff. Our Stephen back there stopped by our booth to talk to it, because what we ended up doing is, you're right, because the members save money, universally on programs like, because you already got those negotiated rates. We're going to send you off to here because you're cost conscious for your patients, and so you're not going to refer to somebody who's going to get taken advantage of on financially. So we have a care navigation team that we're growing constantly to try to steer members to. And so when our members call us, right, and so we're trying to promote that this last year, our care navigation model more. And so, but we're trying to make improvements to it every day. So if you want to stop by our booth and talk to them about it, yeah.
Yep. At CHM, we have Advantage Care Solutions. I needed a nuclear stress test. I had no idea what that was. And they said it was going to be $9,500. I told them my cash payer, no can do. $6,200 at the Cleveland Clinic. I made one phone call to our ICS. Our ACS was able to go out and look on a platform very quickly. I'll be going at 145 across town here for $1,200. It was originally $9,500. It's dropped to $6,200. It's $5,000 below that. And I'll guarantee you that the practitioners over here are better taken care of than at any of the other facilities. So,
you brought up a good point. Yeah, that's a great point. And we can always do better at care navigation. We're trying to. So, one last question before we have to depart. It's got to be a legal question, though. No, just kidding. So, prior education, and that's where, especially when our members call in, we try to, and that's the biggest thing for this movement with the self-pay movement. And what we're doing here is you have to empower the members. And that's the difficult thing. So through education mostly, but the days are gone where there's two options you have, right? I don't care what medical care costs. I want to give my insurance card. I don't care what happens. You're going to overpay, because if you're on a health insurance, you're going to pay about 250% what Medicare would pay, right? But if you're on a health sharing ministry, you're going to pay anywhere from 150 to 200%. So you save money, but you have to be empowered. So we have to have a movement among these consumers to change that paradigm and that inculcation that's happened since the 1930s in this country, right? Show a card and I don't care what things cost.
Our mission eclipses just the transactional value of what we do. We also equip people to make that transition from a claimant to a consumer. That's part of our mission, education. And so as we can do that, that helps, but also being able to facilitate it with a very quick call to be able to get that second opinion and point to Proverbs and Solomon, who said, in the multitude of counselors there's safety. And so those are the ways that we can point in and get our groups to come in and say, wait a minute, Doc, what did you just propose that you want to do to me? And maybe I need to get a second opinion. Let me think that through. Let me AI it, and I'll get back to you. So.
Exactly. And it also comes too from the conscience side. I'm certified in bioethics, so you're going to get illegal and bioethical stuff here from me. But we prevented an abortion a couple of years ago because what the doctor put in his chart notes, and then we called the member and said, "Did you know you just authorized an abortion?" I did. I didn't know what that language was, and so then the doctor calls in and starts backpedaling and say, "No, this baby's not going to make it." Well, do this procedure. We got him referred to another doctor for advice, did the procedure, and the baby started to get healthy inside the womb and was born healthy like 3 months later. And so that's something that we sometimes with us, and you'll see this too when working with Solidarity, is we do pre-notification on procedures only for moral and ethical issues to make sure they're morally and ethically permissible under the law. So I think that's it.
Time's up.
Yeah.
Thank you.